Hey, hello students. Am I audible? Yes. There. Fine.
The best price car.
Okay, fine. Okay, so hope I'm audible. Okay, we'll start. Okay, guys. Okay, we'll start. This is the second session on this FMG Accelerate session. PSM second day. Yesterday we have done one session. Today this is our second session. Okay, we'll start here. Okay, answer the question, guys. Okay, answer the question. Okay, today we'll start with communicable disease. It's another important topic as far as our exams are concerned. So every exam you'll get around 6 to 8 questions. Okay, more than 8 questions comes. Okay, what is the answer for this question, guys? Yes, this is not smart board. Okay, we are going to use tab. Okay, tab teaching. Rachit Jindal. Okay, fine. Yes. What is the answer for this question? Recent transmission of malaria can be calculated. These are some indicators for malaria here. We are going to use, okay, for malaria elimination. The first most important is annual parasite incidence. Okay, annual parasite incidence is, okay, confirmed cases, okay, by population at risk multiplied by 1000. This is the most important indicator. Okay, fine. Confirmed cases of malaria by population at risk. Okay, fine. Now, what is this? But the answer for this question is infant parasite rate. Infant parasite rate. Infant parasite rate is percentage of infants showing parasite in the blood. Infants means less than 1 year. Parasite in the blood. This is infant parasite rate. Okay, so that indicates recent transmission for malaria. Recent transmission. Next, what is spleen rate? Spleen rate is, okay, percentage of children between 2 to 9 years with enlarged spleen. That is spleen rate. Percentage of children between 2 to 9 years with enlarged spleen. Okay, so you are examining the children between the age of 2 to 9 years. How many children having enlarged spleen? So this is an example of this indicates endemicity. Okay, spleen rate, and this one indicates recent transmission of malaria. So that was the question. Okay, recent transmission of malaria. So out of this, which is the most important indicator? The most important indicator is, okay, that is the first one, infant parasite rate. Infant parasite rate is the most important indicator. So we want this infant parasite rate. Okay, the goal is to eliminate malaria. The goal is to eliminate malaria. Okay, so that we want to have API, that is annual parasite incidence, should be less than 1 per 1000 population. It's a new point for you. So the goal is to eliminate malaria. Okay, so for that we have to achieve this API, annual parasite incidence, should be less than 1 per 1000 population. Okay, fine. Hope you understood. Am I audible, right? Okay, we will continue. We'll go to the next question, guys. We'll go to the next question. Okay, fine. Answer the question. Come on, answer the question. Disease transmitted by the vector shown in the image. Okay, so you get 1 or 2 entomology questions in your exams, image based question. Recently we are seeing this mosquitoes being asked. So what is the answer for this? Disease transmitted by vector shown in the image. Yes. What is this mosquito? What is this mosquito? Yes. Yes. This is Culex. Culex. It exhibits this hunchback. Okay, it sits with a hunchback. A Culex sits with a hunchback. There is no stripes. Stripes you will see in Aedes mosquito. Okay, fine. This is Culex mosquito. Where this Culex mosquito breeds? It breeds in dirty water. Okay, it breeds in dirty water. Dirty water. And what is the disease it transmits? That was the question. So they given the image. The image, this is Culex mosquito. It transmits 2 diseases in India. Important one is filariasis. Okay, and second one is Japanese encephalitis. This is one and this is second. Okay, the first one is filariasis, second one is Japanese encephalitis. JE guys, JE. Filariasis and Japanese encephalitis. It breeds in dirty water. Dirty water. Hunchback will be there and no stripes will not be there. This is Culex. Multiple times they ask this. Okay, fine. I'll show some other image also. I will show. Okay, fine. So you see this one. What is these 2 mosquitoes are? What is these 2 mosquitoes? Yes, this is excellent. Okay, this is what? This is Anopheles. The first one is Anopheles. Okay, how do I say it? Anopheles? Because it sits with an angle. Sits with an angle to the surface. Okay, no other mosquito will sit with an angle to the surface. Only this one will sit with an angle to the surface. Okay, and its wings are spotted. If you see, these are the wings. Spotted wings will be there. Spotted wings. Okay, wings are spotted. And what is the disease it transmits? Anopheles mosquito. Yes, Anopheles mosquito, it transmits malaria. Okay, malaria, and it breeds in fresh water. Breeds in fresh water. It breeds in fresh water. It sits with an angle to the surface and its wings are spotted and it breeds in fresh water. Okay, malaria. And what about the other one? This one is, okay, hunchback is there. Hunchback present. Stripes are there. Look at the stripes. Stripes present. Hunchback present and stripes are present. What is this mosquito? Yes, Aedes mosquito. This is Aedes mosquito. Hunchback. Okay, it's okay. Hunchback will be there, and it breeds where it breeds means it breeds in artificial containers. It breeds where? It breeds in artificial containers. It exhibits hunchback. Hunchback, it exhibits the sitting position is hunchback will be there. And what are the disease it transmits? So it breeds where? It breeds in air coolers, okay, flower pots, okay, fountains, okay. Any artificial container, this will breed. Okay, fine. So what is this a disease it transmits? Transmits dengue. Okay, it transmits dengue, it transmits chikungunya. And it transmits Zika virus. Recently asked question in NEET exam. Okay, it transmits, okay, Zika virus. Okay, Zika virus is transmitted by which mosquito? That is transmitted by this Aedes mosquito. Okay, fine. So am I clear? Shall I continue, guys? Next. We'll go to the next one, guys. We'll go to the next one. Next question. Okay, answer the next question. A 2-year-old child with bottle fed, irritable, extremely thirsty, coming with the children. 14 episodes of diarrhea was there, and a child was eager to drink. What should be done? So any child with diarrhea in our setting, we have to follow some guidelines called as INCA guidelines, Integrated Management of Neonatal and Childhood Illness Guidelines. INCA guidelines. INCA guidelines. Okay, fine. Now, so child with diarrhea, what is our job? Our job is to rule out dehydration. Okay, most commonly diarrhea is one of the most common cause of death in children actually. Okay, fine. So any child with diarrhea, you have to look for 4 signs of dehydration. So look for signs of dehydration. So what are the things you have to look for? You have to look for general condition of the baby. What is the condition of the baby? Okay, how is the baby? Okay, fine. Second, you are going to look for sunken eyes. Okay, whether the child is having sunken eyes is there, you are going to check. Third, you are going to look for offer water. You are going to offer water to the child, and you are going to check whether the child is having thirst. Okay, that you are going to assess. Fourth, you are going to look for skin pinch test. Okay, you have to pinch the skin, so you are going to look for the elasticity. Where will you check for the skin pinch test? Where will you check? Yes. So you have to test skin pinch test has to be done in the abdomen. Fine. Now, when the baby looks general condition normal, sunken eyes no, thirst is not increased, skin pinch test is normal. If everything is normal, what is this? Yes, what is this? This is no dehydration, guys. And everything is normal. This is no dehydration. General condition, sunken eyes, thirst. Okay, everything is normal. Okay, the second one we will see. Baby looks irritable and restless. Sunken eyes present. Thirst is increased. The baby is eagerly drinking water. And skin pinch test takes less than 2 seconds. Normally, it should come back immediately. If you pinch and leave, it means it should come back immediately. But here it takes less than 2 seconds. So this we call it as some dehydration. Some dehydration. This is no. This is some dehydration. If any 2 is there, this is some dehydration. All need not to be there. Any 2. If any 2 is there, this is some dehydration. Third. The third one is baby is lethargic and unconscious. Okay, lethargic and unconscious. Sunken eyes present. Not able to drink. Okay, so more than 2 seconds. Okay, it takes more than 2 seconds. Okay, fine. What is this? Yes, this we call it as severe dehydration. Any 2 is there is also fine. Any 2. If any 2 is there also fine. Okay, fine. So no dehydration, some dehydration, severe dehydration. These are scenario based questions, guys. Okay, you will get scenario based questions. So you should be able to answer. This is a easy only. Okay. What is the answer here? What is the answer here? Yes. Okay, look here. So based on this, we'll see. So the baby is irritable. One feature is there, and eager to drink water. So what is the answer here? Yes, this is, we call it as ORS. Some dehydration. We can go with ORS. Okay, fine. So some dehydration we can give with ORS. No dehydration, you can give home-based fluids. Okay, rice water, dal water you can give. Some dehydration ORS. Severe dehydration you have to provide IV fluids. That is the treatment. Okay. Home-based you can give ORS, home-based fluids, no dehydration. Some dehydration you can give ORS. Okay, WHO reduced osmolarity ORS is there. Severe dehydration you can give IV fluids, guys. IV fluid. Okay, fine. So am I clear? Hope this is clear. We'll go to the next question. Answer the question, guys. What is this image? What is this image? Okay, what is this? Refer to the image below. Bull neck appearance. They are saying bull neck appearance. Okay. So bull neck appearance means only one condition will provide bull neck appearance. That is diphtheria. Okay, fine. Diphtheria. The source for diphtheria is caries. Okay, the source for diphtheria is caries. Patient will come with membranous patch actually. Okay, so over the tonsil area inside, membranous patch will be there, and plus this lymph node enlargement will be there. Lymph node, that we call it as bull neck appearance. Okay, membranous patch and bull neck appearance. If you are seeing this type of condition, okay, it's a medical emergency. Okay, so what you are supposed to do is that you have to treat them. So what is the treatment? Agent is Corynebacterium diphtheriae. What is the treatment? Is you have to give penicillin. One is penicillin you have to provide. Second, you can give antitoxin. Okay, so you can give based on the severity. So 20,000 to 1 lakh international units you can provide. 20,000 to 1 lakh international units you can provide penicillin, and you can give antitoxin you can give. Okay, fine. And this is the treatment for cases. What about caries? They are the most important source. For caries, we have to provide erythromycin. Okay, for caries, we can provide erythromycin. Okay, fine. So, am I clear? So, this is a case of diphtheria, guys. This is a case of diphtheria because the membranous patch can produce toxins. So, that's why it's a medical emergency. So, we have to treat them with antitoxin we have to give, otherwise it can cause myocarditis, it can cause. Okay, so that is the reason this diphtheria. And even if you immunization also, it does not prevent carrier status, because the immune what we are giving only toxide. Okay, diphtheria is toxide. Okay, DPT is coming, right? Diphtheria and tetanus is toxide, and pertussis is actually is a killed vaccine. Okay, diphtheria is a toxide actually. Next question. What is the answer for this one? We have around 45 questions covering different areas. Now, measles vaccine given at 7 months of age. When will be the next dose? Come on, answer it. I want you to answer it. Yes. You can answer. What is it? Yes. Measles vaccine at 7 months of age. Normally, when will you give measles vaccine? Okay, measles vaccine, MR vaccine. Okay, we give MR vaccine usually at 9 months. Okay, it's a live vaccine. So the measles vaccine strain is Edmonston Zagreb strain. Okay, Edmonston Zagreb strain. Okay, fine. Okay, but during epidemic, okay, 6 to 9 months babies also you can give measles vaccine during epidemic. Normally till 6 months maternal antibodies will take care. Okay, but 6 to 9 months during epidemic, suppose everywhere there is a case of measles, you can give measles vaccine in this time. That's what the question is. Okay, so the vaccine was given between 7 months. Okay, but what you are supposed to do, you have to revaccinate again at 9 completed months. You have to revaccinate completed months. So am I clear? So measles vaccine, even if you give at 6-7 months, but don't consider the dose. So you have to revaccinate it. Revaccinate at 9 months. Right. Yes. So you have to revaccinate at 9 months. You have to revaccinate. Okay, fine. What is the name of the strain for rubella vaccine? Okay, rubella vaccine. What is the name of the strain? Okay, rubella vaccine is Okay, RA 27/3 strain. Next question, how long you can give the measles vaccine? How much time? MR vaccine, maximum till what age we can give? MR vaccine in our schedule, vaccine maximum it can be given for 5 years. It can be given for 5 years. Okay, fine. One more question here. Okay, what is the pathognomonic feature of measles? That was asked recently in NEET exam also. What is the feature? The feature of measles. Yes, measles, the pathognomonic feature is, what is it? Yes, it is complex spots. Okay, it appear 1 to 2 days before rash. Okay, it will be there in the buccal mucosa. Okay, so bluish white lesions opposite to the first or second lower molar tooth, and it will appear 1 to 2 days before the rash. Okay, this is complex spots. Recently this NEET exam also they asked this question, complex spots. That is the feature. Next question, guys. A pregnant female was scratched by a street dog. Okay, on examination oozing of blood is seen. What is the treatment given? So this we are talking in terms of what? For rabies prevention. Okay, answer this question. Yes. Okay, so first what they have to do is that we have to categorize the wound. Okay, so category 2, once we'll see category 3. So category 2 is no, so any abrasions, okay, or nibbling without blood should not be there. Without blood should not be there. Okay, category 3, okay, anything lacerations or abrasions, okay, wild animals with blood is there means it becomes category 3. Okay, so if any dog bite or any bite, so whenever you are seeing this case, okay, you have to categorize the wound. So abrasions, nibbling without blood means what you are supposed to do is that you can give vaccine. Okay, you can give vaccine and you can check whether the animal is healthy or not. Okay, you can give vaccine. Category 3, laceration means you have to give vaccine plus you have to give immunoglobulins. For immediate protection, you have to give immunoglobulins, you have to provide. Okay. So you'll go back to the question and you answer. Go back to the question, you answer. What is the answer here? What is the answer? So here the key point is oozing of blood is seen. Okay, so we are seeing blood. Okay, so that means we have to give immunoglobulins. Okay, for all the cases we have to do wound washing, we have to do. Okay, so immunoglobulin, vaccine and local wound washing. How much time we have to wash the wound? Local wound washing. Wound washing is 15 minutes you have to use with running water. Okay, tap water you have to use for 15 minutes. 15 minutes you have to use running water. Tap water you have to use. Okay, fine. Am I clear? So in a government program, okay, what is the vaccine we give? If you go to government hospital, they will be providing updated Thai regimen. Okay, they will be taking this updated Thai regimen. Okay, the Thai regimen, what is they are giving? 0, 3, 7 and 28 days. 4 doses you have to provide. This is what we give. This is intradermal regimen. Okay. 0.1 ml, but every time you have to provide 2 sites you have to provide. Okay, 2 sites each day. Okay, so left arm if you are providing 0.1 ml, right arm also you have to provide 0.1 ml. This is updated Thai regimen, guys. Updated Thai regimen. Okay, fine. We'll go to the next question, guys. Intradermal regimen. Causative agent for Kala Azar or visceral leishmaniasis In India, okay, we are reporting only this Kala Azar, and the answer is Leishmania donovani. What is the vector for this condition? The vector is, okay, Leishmania donovani, it is the sandfly. Sandfly. Patient comes with hepatosplenomegaly, okay, splenomegaly. Only certain parts of India, only they are endemic. Uttar Pradesh, Bihar, Jharkhand, okay, West Bengal. These are the 4 states they are endemic. And hepatosplenomegaly, if anybody is coming from this place with hepatosplenomegaly, so the kit what program uses RK39 kit. Okay, so if anybody is found to be positive with this RK39 kit, what is the drug of choice we can use? The drug of choice is, what is the drug of choice? The drug of choice is liposomal amphotericin B. Okay, liposomal amphotericin B. That is the drug of choice. Okay, so we use this RK39 kit, and drug of choice is amphotericin B, guys. Amphotericin B. Fine. Answer this question, guys. A patient is resistant to isoniazid, rifampicin, ofloxacin, and kanamycin. What type of resistance is this? Okay, fine. So we'll see resistance. Okay, so MDR, multi-drug resistant TB, means they are resistant to what? MDR means resistant to, okay, fine, isoniazid and rifampicin. Okay, isoniazid and rifampicin, guys. Okay, fine. Okay, so second is, okay, multi-drug resistance. Okay, second is extensively drug resistant TB. Okay, second is, answer is this one. Okay, extremely, there is no extremely, extensive drug resistant, XDR TB. Okay, XDR TB. Okay, so XDR TB means they are resistant to, okay, one is they should be MDR. Okay, that means resistant to isoniazid and rifampicin. Second, they should be resistant to fluoroquinolones. Okay, they should be resistant to fluoroquinolones. Okay, third, they should be resistant to injectables. Okay, they should be resistant to injectables such as, okay, kanamycin or amikacin. Okay, so this is XDR TB. Okay, MDR and XDR TB. Resistant to isoniazid and rifampicin, MDR, fluoroquinolones, and injectable. This is what this question. This is extensively drug resistant TB. Okay, fine. So we have this. What is new things in TB is that for normal TB, so we are having a patient coming with cough for 2 weeks or fever for 2 weeks. Okay, we do the testing. And treatment category, okay, so we have only one category treatment is available, 2 HRZD and 4 HRE. So 2 months of isoniazid, rifampicin, pyrazinamide, ethambutol. Okay, 2 months, and 4 months of HRE. HRE means isoniazid, rifampicin, and ethambutol. Okay, intensive phase 2 months, continuation phase 4 months we are going to provide. And we are also having this Nikshay Poshan Abhiyan. Okay, Nikshay Poshan Abhiyan. Okay, where we are providing 500 per month during treatment time for the nutritional allowance we provide. Okay, we provide this nutritional allowance 500 per month. Okay, we will be providing nutritional allowance. Okay, fine. So this is about TB, guys. Okay, we are discussing only salient points. We don't have much time. So what is absolutely essential, I'm just telling you. Okay, what is the name of the program for TB now? Okay, name of the program for TB is National TB Elimination Program. Okay, goal is to eliminate TB by eliminate TB by 2025. That is the goal. The goal is to eliminate TB by 2025, guys. 25. Okay, fine. We'll go to the next question, guys. What is the answer for this question? Dots we do. Okay, so 99 dots is there. Okay, fine. Yes. What is the answer for this question? We use an approach called as syndromic approach. Okay, syndromic approach, and the clinic where the treatment for STD is given is called as Suraksha Clinic. Suraksha Clinic. This is also asked one time question. So any patient who comes with a particular syndrome, we will give drugs directly to them. Okay, any patient with a particular syndrome, okay, instead of testing we give drugs. Okay, fine. So what is the answer here? So patient coming with urethral discharge. Okay, urethral discharge, cervicitis. Okay, so for these people you can give gray kit. You can give gray kit. This is one. Second is patient comes with vaginitis. Green kit you can give, green kit. Okay, GUD, genital ulcer disease. GUD means genital ulcer disease. Okay, so you can give white kit. Fourth is GUD, genital ulcer disease, but patient is penicillin allergic. You can give blue color kit. GUD means genital ulcer disease. And fifth is GUD but painful. Okay, herpetic, that means a red color kit you can give, red color kit. And sixth means lower abdominal pain. Okay, lower abdominal pain means yellow color kit. Seventh is inguinal buboes. Okay, swelling in the inguinal region. Okay, you can give black color kit. Okay, inguinal buboes, you can give black color kit. So we'll go to the question. Okay, so the question they said that so what is this question? Yes, it is vaginal discharge. Okay, and lower abdominal pain. For vaginitis they don't give, so we will take this kit 6. Okay, answer is yellow, guys. Okay, yellow kit. Okay, fine. Anyway, this PDF we will upload in the app, guys. Okay, MedEd app. You can access this PDF in that FMGE section. You can access it. Okay, all the previous PDFs whatever we have discussed. Okay, and yesterday's class PDF also we will upload it there. Okay, fine. Next question. What is this one? A case history of child with swelling on face and also swelling in the scrotum. Swelling, okay, swelling in the scrotum. Okay, so this is a case of what? Mumps. Okay, usually in children orchitis will not be there. Mumps. Okay, most common complication in children. Okay, most common complication in children, okay, is aseptic meningitis. Okay, aseptic meningitis. Okay, and children it can also cause pancreatitis. Okay, pancreatitis, it can also cause pancreatitis. Okay, mumps in adults causes orchitis. Okay, orchitis, unilateral orchitis it can cause. Unilateral orchitis it can cause. Okay, fine. Next. This is about mumps. Recently this was asked actually. Aseptic meningitis. Next question. Yellow fever vaccine is valid for. Okay, yellow fever vaccine is valid for. Yellow fever, remember this. Okay. Okay, yellow fever. Okay, yellow fever. We give this yellow fever disease not seen in India. Okay, yellow fever, if it's mostly seen in South America and Central Africa, guys. Okay, so if anybody wants to go coming from South America, Central Africa, they have to take the vaccine. This year NEET exam also this was as 17D vaccine. Okay, so we have the vaccine 17D vaccine. Okay, so once you have taken this vaccine, okay, its validity starts from 10 days of vaccine. They will be providing the certificate, yellow fever certificate. Validity starts from 10 days to lifelong. Okay, lifelong. Okay, validity starts from 10 days to lifelong. Okay, to eliminate this yellow fever, okay, WHO is following a strategy called as I strategy. Okay, what is I strategy? Means elimination of yellow fever epidemic strategy. Yellow fever epidemic strategy. Okay, elimination of yellow fever epidemic strategy, guys. Okay, fine. This is vaccine is valid for how long? Lifelong. Lifelong it is valid. Fine. Okay, we'll go to the next question, guys. Okay, next question. Okay, what is the answer for this question? Okay, so health programs, little bit we will see. This is a multiple times repeated question, which is not a principles of primary healthcare. Okay, so following this declaration in this international conference in Alma Ata, so we accepted certain norms for providing this primary healthcare. So in that, okay, it is made up of 4 principles: community participation, appropriate technology, intersectoral coordination. It is not family mobilization. What is the answer? Okay, what is the answer? Yes, we should be providing equitable distribution. Yes, seaports and airports, there should not be any breeding place for 400 meters, guys. That is right. Okay, for yellow fever, okay, seaports and airports, there should not be any breeding place for 400 meters. Okay, so community participation, appropriate technology, intersectoral coordination, and equitable distribution. Okay, so we should be providing services, okay, equally. So what are the different levels of healthcare? So if you see primary level, so we have sub-center and PHC. Primary level, okay, sub-center and PHC. Secondary level, we have CHC, community health center, and district hospital. DH means district hospitals. And tertiary level of healthcare is, we have is medical colleges. Okay, medical colleges. So sub-center and sub-center we have primary level, and PHC also primary level. Community health center will have at secondary level of care. Next question. Health worker, it's not female actually. Health worker male going out in public once every 15 days for malarial surveillance. What is this surveillance? So answer is active surveillance. Active surveillance means the commonly asked question, okay, house to house search for cases. House to house search for cases. Okay, so that is active surveillance. Okay, you go house to house, you check them. Okay, the health worker male and female, they will be there at sub-center, a place called as sub-center. Normally it will be there for every 5,000 population. Normally it will be there for every 5,000 population. Hilly areas 3,000 population. Normally 5,000 population. House to house search. Okay, what is this passive surveillance? Okay, search for cases. Okay. Okay, the patients are coming to the hospital. Search for cases in the hospitals. Okay, so that is passive surveillance. So people are coming to us. Among them, we search for cases. Okay, COVID we do. Now passive surveillance. Okay, during peak time, health workers went house to house and searching for COVID cases. Sentinel surveillance. Okay, this is to identify missing cases. Identify missing cases. Okay, sentinel surveillance. This is to identify the missing cases. Okay, so missing cases we do identify the missing cases. So we do the sentinel surveillance. We do sentinel surveillance, missing cases. Okay, fine. We do it for HIV. Okay, HCV. Okay, HBV and all we do. So mainly we do it for HIV. Okay, sentinel surveillance. Next. Multiple times asked topic. What is the answer for this one? Women of 25 to 45 years, 8th pass, married, diverse, belong to same village, communication skill. Okay, what is the answer here? Yes, this is a case of, this is Asha, guys. Asha, accredited social health activist. Asha. Okay, these are the criteria for Asha. Asha will be selected for every 1,000 population. Okay, 1,000 guys. Okay, no 2 Asha per 1,000, only 1 Asha per 1,000. These are the criteria for the Asha. Okay, so what is a job responsibility? Okay, she has to promote institutional delivery. Okay, institutional delivery. She's part of which program? Can anyone tell me? She's based this institutional delivery. What is the name of the program? Yes, the name of the program is what? JSY, Janani Suraksha Yojana. Okay, so Janani Suraksha Yojana is a program launched to improve the institutional delivery by providing cash incentive to the mother. Okay, so we'll provide money to you, mother. You come and deliver in the government hospital. Okay, fine. So it's a 100% centrally sponsored program. Central government is sponsoring it. 100% centrally sponsored program. So 1,000 population, to promote institutional delivery, guys. Institutional delivery. So she has to promote and she has to accompany the mother. Accompany the mother for delivery. Okay, she has to accompany the mother. Okay, when the mother is getting delivered, she has to accompany her. So if the mother is getting delivered in a primary health center, she has to visit. Third. Next, she will be having basic depot of drugs. Depot of drugs, contraceptives she will have. Okay, so basic depot. She has this basic depot of drugs, and she will not get fixed salary. What she will get is performance based incentive. Okay, performance. Okay, she will get performance based incentive. There is no fixed salary for her. Okay, so if based on the work, she will get more money. This is about Asha, guys. This is about Asha. Okay, answer this question. Under Ayushman Bharat scheme, okay, so how much money can a family can get per year as an insurance? So we have this Ayushman Bharat scheme. In that we have this Pradhan Mantri Jan Arogya Yojana. So in this we are having, it's a form of health insurance. Okay, yes, answer this recently asked exam question. Health insurance for the families. So how much money? So it will be providing 5 lakh coverage. 5 lakh per family per year. That is a coverage. 5 lakh money per family per year. And this coverage leads to what? Okay, 5 lakh per family per year. So all members are included. Okay, father, grandfather. Okay, everyone is included. Even old people are included. Private insurance means they will cost it more. Okay, but here they include everyone. All members included. Okay, all the members are included. Even pre-existing disease also included. Pre-existing diseases. Okay, diseases are covered here. Covered. Right. So this is Ayushman Bharat, guys. Okay, answer is 5 lakhs. Okay, 5 lakhs coverage they will get. Okay. What is the most common cause of blindness among children in India? This is also a recently asked question. Come on, what is the answer? Yes. So this is children. The question is children. Children, it is vitamin A deficiency. For adult, okay, cataract is the most common cause for adult actually. Adult. Okay, and we have a program is there. So National Program of Control of Blindness and Visual Impairment. This is the program, guys. Okay, National Program of Control of Blindness and Visual Impairment. According to this program, So what is the definition for blindness? So blindness should be vision less than 3/60. That is the blindness. Okay, this is the criteria we follow, and our goal is to bring blindness levels less than 0.25 percentage. Our goal is that refractive error is not the most common cause. For children it is vitamin A deficiency. Our goal is to bring blindness levels less than 0.25%. So that is why they are running these camps. So they bring patients from the camp, they shift them to hospitals for surgery, guys. So surgery, then they will take them back to the villages, camps. This is what we do. So fixed facility surgery, we are providing fixed facility surgery now. Previously they used to do mobile van itself, they do the surgery. No, nowadays we do surgery, fixed facility surgery we do. This is about vitamin blindness control program, guys. National program for control of blindness and visual impairment. Answer this. What is this? Ujawala scheme is the prevention of what? What is this Ujawala scheme? Ujawala scheme is prevention of, excellent. Answer, Ujawala scheme is child trafficking. So prevention of child trafficking. What is the next one? Lakshya. Can anyone tell me what is this? Lakshya is what? This is also recently asked question. Lakshya is related with what? Yes, it is related with labor room quality initiative. Labor room quality initiative. This is Lakshya. Lakshya, labor room quality initiative. That means all the labor room in the country, they should maintain some standards. So we have a checklist is there, and whether it's fulfilling the standards or not. That is Lakshya. Next is, what is this Kayakalp award is for what? Kayakalp award. So it is the cleanliness award. Cleanliness award. TB, that is Nikshay, guys. Nikshay. TB is Nikshay. That is different. There's a portal is there. That is Nikshay. Cleanliness award. For PHC, CHC and all. This is Kayakalp award. What you have written is TB here is Nikshay. Portal for TB. For TB. That is Nikshay. So you have a web portal. So to monitor the cases, we are having this Nikshay. Second is Nishay. Nishay is a pregnancy test kits. Pregnancy test kit, that is Nishay. One more is there, that is Nikust actually. This is also a portal for leprosy. For monitoring the cases, leprosy. So this is cleanliness award. Kayakalp is cleanliness and infection control. And Nikshay is portal for TB, Nishay pregnancy test kit, Nikust is for portal for leprosy, guys. Leprosy. Next question. All are true for PHC except. Question is PHC. It covers 30,000 population, that is right. Hilly areas 20,000. Hilly areas 20,000 population. Is the first delivery facilities will be available. Yes, normal delivery will be there. First contact between the doctor and medical officer. First contact. Fine. So this is PHC. 4 to 6 beds will be there. 4 to 6 beds will be there. Medical officer will be there. Lab technician will be there. First referral center, usually that is CHC, Community Health Center. And the Community Health Center will be there for 80,000 to 1.2 lakh population. 80,000 to 1.2 lakh population. 30 beds will be there. And we have specialists will be there. To call it as first referral center, they should have facilities for cesarean section. The OT should be there, and they should be having anesthetic facilities should be there. Okay, blood bank facility should be there to call it as first referral center. And usually that is CHC and above. Above CHC means maybe sub-district hospitals, so that can act as a referral center. Okay, for first referral center. For screening of cervical cancer, which is the most cost effective method? Okay, so before going into that, can you tell me what is the most common cancer? Okay, most common cancer among males, females, and overall. Okay, fine. What is the most common cancer among males? Okay, males, what is the answer? It is oral cancer. Okay, oral cancer. What about females? It is breast cancer. Females. And overall cancer is common among females. It is breast cancer. Overall, in India, we are talking about India. Okay, overall it is breast cancer. And females, males, oral cancer. Males, it is oral cancer. Okay, now the question is cervical cancer. What is the answer for this question? Cervical cancer, what is the answer for this question? Yes, for cervical cancer, okay, we don't do pap smear. Okay, that is practically it's difficult. So what we do in the program is that we do this one, visual inspection with 5% of acetic acid we do. Okay, so this one we do. Okay, visual inspection. Okay, so this is little bit easier actually when compared to pap smear. Pap smear you require microscope and a lot of other things, but this is what we follow. What is the answer for this question, guys? Which of the following is included in the NPCDCS? This is the program. Okay, what we have included in this NPCDCS program? Okay, fine. What is the answer here? NPCDCS. Okay, this is the program for national program for what? The question is, what is this CDCS is what? Okay, so this is a non-communicable disease program. Okay, fine. What is this? Cardiovascular disease, diabetes, cancer, and stroke, guys. Okay, the answer is cardiovascular disease, cancer, diabetes, and stroke. Okay, fine. So according to this, it claims that okay, subcenter level we should screen for diabetes and hypertension at subcenter level. Okay, people more than 30 years we have to screen. And this, according to this program, we should have a NCD clinic. Non-NCD means non-communicable disease clinic should be established at CHC level. CHC level. Okay, non-communicable disease. And at district hospitals, okay, at district hospitals, okay, we should have, at district hospitals, we should have palliative care clinic. Palliative care. Okay, palliative care means suppose terminal ill patients, we can't save them. Okay, what we can do is that we can reduce the pain actually. Okay, so that is palliative care clinic. Palliative care clinic. So that we do. Okay, that should be available at district hospital level, and NCD clinic should be there at CHC level. It should be the CHC level. Fine. Okay, we'll go to the next question, guys. Answer this question. Incorrect about World Health Organization. Okay, what is the statement? International health, you get 1 or 2 questions, you get every exam we are seeing that. Okay, so what is incorrect? Okay, all are right, guys. Okay, objectives attainment to all people of the highest level of health. Its headquarters is located in Geneva. Okay, WHO came into force in 1948. This is also right. What is wrong here is it is not a political agency. Okay, it is a specialized non-political agency. It is a non-political agency of United Nations. So we have this United Nations is there. It's a specialized non-political agency. It came into force 1948 on April 7th. April 7th. So this day we celebrate as the World Health Day. Okay, this day is celebrated as the World Health Day. Now think and answer. Okay, we are tomorrow, I think, is the April 7th. Okay, so what is the World Health Day theme? Can anyone tell me what is the theme for this year, tomorrow? What is the theme? The theme is, okay, theme is health for all. This is the 75th anniversary of World Health Day. 75th. So World Health Organization. The theme for this year 2023 is that. Okay, so 2023. This is 2023 theme. Okay, health for all. Health for all. This is also a recent question. Which organization funds for national TB program? This is the long back this was done. So for TB program we have this SIDA, Swedish International Agency. SIDA means Swedish. Okay, so Swedish International Agency, they contributed. Okay, we have one more agency is there called as DANIDA. Okay, this is the agency from Denmark. They contributed to this National Blindness Control Program. National Blindness Control Program. Okay, so National Blindness Control Program, they contributed, SIDA. Okay, so we have this Rockefeller Foundation. Okay, older times we have this Rockefeller Foundation. Okay, so foundation, and they contributed to the hookworm. Okay, hookworm. Okay, to control hookworm control in Madras presidency, that is before independence. Okay, Madras presidency. Okay, Madras, you may be wondering, okay, why they will ask question. Yes, they are asking this question. Okay, so SIDA for National TB Program, DANIDA is for National Blindness Control Program, Rockefeller is hookworm control in Madras presidency. This year in NEET exam they asked this question, Colombo plan. Colombo plan, they contributed for cobalt plants. Okay, for cancer treatment, cobalt plants they contributed. This is Colombo plan. This was asked in this year NEET exam. NEET exam. So everything is there. The textbook of Park. Okay. So Colombo plan this year 2023 NEET exam. This was the question. Fine. What is this Niti Ayog? Represents what? Okay. In your exam question, Niti Ayog is national institution. Actually, it's not institute. Actually, national institution. Okay, for transforming India. This is Niti Ayog, guys. This is the Niti Ayog, National Institution for Transforming India. Okay, fine. Now look here. Okay, under the leadership of United Nations. Okay, under the leadership of United Nations, all countries accepted certain goals. That is called as SDG, Sustainable Development Goals. All countries, they say that from 2016 to 2030, okay, we will achieve certain goals. These are called as SDG, guys. SDG. Okay, so SDG, Sustainable Development Goals. And how many goals are there in SDG? There are 17 goals are there. So among them, goal number 3 is linked to health. Okay, among them, goal number 3 linked to health. Okay, so this is goal number 3. Okay, all are related questions only. Okay, fine. India is also signatory of this SDG goals. To achieve these SDG goals, we have this Niti Ayog. Niti Ayog is created. Okay, India's response to achieve these goals, guys. Niti Ayog. Actually, Niti Ayog replaced what? Something was there before Niti Ayog. Actually, Niti Ayog replaced it. Niti Ayog replaced. They replaced Planning Commission. Okay, they replaced Planning Commission. Niti Ayog They replaced Planning Commission, they replaced Niti Ayog. Okay, fine. So previously we used to have Planning Commission. So since 1850s itself, they used to make these 5-year plans. So that has been replaced by this Niti Ayog. Okay, fine. It's our response to achieve these SDGs, Sustainable Development Goals. 17 goals. Goal number 3 is directly related to health. What is the main focus of UNICEF? UNICEF means United Nations Children's Fund. Okay, its headquarters is located in New York. Okay, the answer is child health. So it's mainly focuses on child health, child nutrition. There is acronym is there. GOBI triple F. Growth monitoring for UNICEF, growth monitoring, ORS, breastfeeding. Okay, it's an international agency. Okay, that focuses on child health, ORS. Okay, that is growth monitoring, ORS, breastfeeding, immunization, female literacy. Okay, female literacy. Okay, family planning and food fortification. Okay, food fortification. This is GOBI campaign. We call it as GOBI campaign. So that is UNICEF, guys. That is UNICEF. Campaign by UNICEF. Growth monitoring, ORS, breastfeeding, immunization, female literacy, family planning, and food fortification. Okay, fine. So this UNICEF also contributed to our applied nutrition program. Okay, they have given manure and seeds. Okay, for our applied nutrition program, that was also asked as a question last year in NEET exam. We'll see some biostatistics questions. Okay, answer this question. Identify the following diagram as given below. What is the name of the graph? Okay, fine. So we have different colors are there. So this is what data? Qualitative data. Okay, qualitative data. That means, okay, blonde is there, brown is there. Okay, brown, red is there. Okay, black is there. Okay, so these are colors. Qualitative data. This is bar diagram. This is bar. Within the bar itself, components are there. Okay, so what is the answer? This is component bar chart. This is component bar chart. Just bar means it will be like this. Okay, this is simple bar. This is simple bar. This is simple bar chart. Simple bar chart. Okay, within the bar itself, more variables are compared. 2 or 3 variables are compared here. This is component bar chart. Component bar chart. How the multiple bar chart will be there? Multiple bar chart will be like this. Okay, multiple bar chart. Okay, so it will be like this. So 2 or more variables that will be there together. 2 or more variables are compared side by side. This is multiple bar chart. 2 or more variables are compared side by side. The first one is simple bar chart. This is simple. This is multiple. 2 or more variables are compared side by side. And the question here that is given is, what is this? This is 2 or more variables are compared within the bar itself. Okay, you can see, okay, multiple components are there. So this is component bar chart. Component bar chart. Okay, fine. So how pie chart will be there is, pie chart is percentage. A circle will be there. Okay, suppose in a classroom 60% girls and 40% boys are there, means I can say that 40% girls, boys, and 60% girls. So this is pie chart. This is pie chart. Okay, pie chart. This is the first what we have seen is, okay, bar chart, pie chart. This is pie chart. Okay, this is also used for qualitative data. Qualitative data means any data that is measurable. Okay, so sex, okay, so religion, okay, so also these are measurable, not measurable. It's a quality, fine. What is this graph, guys? Come on, answer this. What is this graph? Identify the statistical diagram shown below. What is this graph? This is also looks like a bar chart. What is the answer? Bar chart, what we have seen, there will be space will be there between the bars. Here, what is not there? There is no space between the bars. So no space. Okay, no space between the bars. So this is what diagram? This is histogram. Histogram. Bar chart we have seen. Look at the previous map. So this one is we have space we had. Okay, here we don't have space. This is histogram. Histogram means there will not be any space will be there. Okay, next. We have one more diagram is there called as line diagram. Okay, line diagram will tell you trend of the event. What is the trend of COVID cases? Okay, in the last 1 year. Trend of the event over a period of time. Okay, trend of the event over a period of time. This is line diagram, guys. Line diagram will give you trend of the event over a period of time. So we have seen bar diagram, we have seen. Okay, histogram we have seen. Okay, so pie chart also we have seen. Line diagram, what is the trend of COVID cases? Okay, so I can show the trend. Okay, fine. Time will be there in the x-axis. So what is the trend of COVID cases? Okay, fine. Whether it's increasing or decreasing, okay, that is given by this graph. Line diagram. Okay, fine. Am I clear? Okay, we'll continue, guys. We'll continue. If wide range of values are present in a community, then what is the best measure of central tendency? Okay, so central tendency means we have mean. Mean means average, guys. Okay, mean means average. Okay, average. Suppose I have some five numbers are there. Okay, you add all those values. Okay, and divide it by the total number. That is average. Suppose I have these numbers. 1, okay, so how much is it? Okay, 7 plus 5, okay, that is 12. So how much is? So we'll make it simplified 8. So 15, this is 3, guys. Okay, 15. So total is 15. 15 by 5, that is 3. This is mean. Mean means average. You add all the numbers and divide it by the total numbers. Okay, but this will be affected by extreme values. Extreme values means extreme values there. Suppose instead of 8, if I put 15, now what happens? Okay, not 15, we will make it as 50, we will make it. So what happens? So the mean will be severely affected. Extreme value means, okay, extreme value or outliers. Extreme value or outliers means will affect mean. Will affect mean. So any extreme value in the data, this is what the question is. So any extreme values in the data that will affect the mean. So now see 50 plus 57 by 5 means it goes more than 10 actually. Okay, so in extreme value in the data means it will affect the mean. So now what we can do is that, so we can go for median. What is median? Median means middle value. Okay, middle value. You arrange the data in either ascending or descending order. Okay, so you arrange here. So 1, 2, 3, again 250. So now what will be the middle value? Okay, 2. This is the middle value. Okay, so middle value. So mean, median, even if the extreme value is in the data, that is not affected. Median is not affected. Okay, fine. So the fourth one is what is mode. Third one is what is mode is most repeated value in the data. Okay, most repeated value in the data. So which number comes again and again? So that is mode. Which number comes again and again, that we call it as mode here. Okay, fine. So if the data is having like this, okay, so So which number came again and again? Okay, so the number which came again and again is the 1 here. So this we call it as mode. So the most repeated value. Okay, we'll come back to the question here. We'll come back to the question. Okay, now what is the answer here? If wide range of values are there in the community, what is the best measure? Okay, wide range of values means they are talking about extreme values or outliers. What is the answer here? If extreme value or outlier is present, okay, then it becomes median. Okay, extreme value or outlier is present. The answer for this question will be median, guys. Okay, median. Next. Okay, next question. A 42-year-old female present with the rural PHC. Which are the following statistical tests to find whether obesity is a significant risk factor? Okay, the question is they are looking for the test of significance. Test of significance, obesity and breast cancer. Okay, obesity and breast cancer both are qualitative data. Qualitative data. Okay, so for qualitative data, which are the following test of significance we can use? Okay, so the only qualitative data we can test of significance is chi-square test. Okay, so chi-square test only we can use it for qualitative data. Okay, suppose I have two groups are there. Okay, obese people, breast cancer, non-obese people, and I am checking for the breast cancer. So two groups I am looking. So then the possible best answer here is chi-square test. So what is the student t-test? Suppose this is for quantitative data. Okay, this is used, both are used for quantitative data. Quantitative data. So what is this quantitative data? Okay, suppose I have a blood pressure. Okay, blood pressure. I have two drugs available. Okay, so hypertensive patients I divided into two groups. Suppose a classroom is there, I divide them into two groups. Okay, so for one group hypertensive, all are hypertensive, let us assume. For one group I am going to give drug A and other group I am going to give drug B. So blood pressure is measurable, that is quantitative data. So one group drug A, other group drug B, and after some time I am comparing the blood pressure. So between two groups, that means that is student t-test or unpaired t-test. So blood pressure for two groups quantitative data. Okay, two groups quantitative data. Okay, what is paired t-test? Okay, only one group is there. So I am checking the blood pressure of that group and give a drug for 1 month. After 1 month I am rechecking the blood pressure. So this is one group before and after. If you have queries, post it there, guys. Okay, so one group before and after quantitative data. These three questions only will be asked. If at all, if they are asking only these three. I'm repeating again. Quantitative data. Okay, that is blood pressure. Okay, only one group before and after. That means paired t-test. Okay, quantitative data, two separate groups are there. Okay, anything that is measurable, cholesterol, blood pressure, two separate groups are means paired t-test. Okay, and qualitative data, there is only one test that we are going to use, that is chi-square test. For your exam, that is enough test. Fine. What is the percentage of one standard deviation and normal distribution curve? So this is normal distribution curve. It will be like this. When you are presenting the data, okay, so it will be like this. Okay, fine. Now, what are the properties of this normal distribution curve? What are the properties of this normal distribution curve? It's a bell-shaped bilateral symmetrical curve, guys. Okay, bell-shaped bilateral symmetrical curve. Area is equal to 1. Area of the curve is 1. Okay. Mean, median, mode, all should be same. It's a bell-shaped bilateral symmetrical curve. Area of the curve is 1. Mean, median, mode, all should be same. And mean plus or minus 1 standard deviation corresponds to 68% of the area. These are okay, statistically proven this one concept. So mean plus or minus is 1 standard deviation. Mean plus or minus 2 standard deviation is 95% of the area. Mean plus or minus 3 standard deviation is 99% of the area. Now answer the question, guys. What is the answer here? The bell shape. I'm not going in detail, but basic concept is fine here. So this is a normal distribution curve. Okay, so bell shape, bilateral symmetrical, area 1, mean, median, mode, all are same. Mean plus or minus 1 standard deviation. The question, what is the question here? What percentage of 1 standard deviation? So 1 standard deviation is how much here? 68.3%. This is what the concept is. Answer this question, guys. Okay, answer it yes. These are easily answerable. A person with a history of 30 years of working in a cardboard manufacturing industry develops breathlessness and cough. Chest X-ray shows mottling in the lungs. So the clue here is cardboard industry. Can you tell me cardboard industry? Okay, what is the yes, in cardboard industry they use sugar cane dust actually. In cardboard industry they can use sugar cane dust. Sugar cane dust means what type of pneumoconiosis it can present? Yes, sugar cane dust means it can present with bagasosis. This is the answer. Bagasosis. Sugar cane dust means bagasosis. Bicinosis is reported on people working in cotton fibers. Okay, cotton fibers, especially textile industries, guys. Okay, textile industry. Okay, cotton fibers and textile industry. So bagasosis means sugar cane dust. Okay, bicinosis means cotton fibers, textile industry. Textile industry, it is common. Okay, fine. Next. Answer this question. Next question. Yes. A medical officer examines workers in mines and diagnoses silicosis. What should be the comments? So the point here is silicosis. Silicosis. What is the answer? Come on, answer it. Silicosis, it affects these apical lobes. It will affect, guys. It will affect these apical lobes. Okay, apical lobes it will affect. Okay, it will affect these apical lobes. What is the X-ray features? X-ray features, silicosis. What is the X-ray? Is if you take X-ray, it will show snowstorm appearance. Okay, X-ray, it will show snowstorm appearance. And what is right here? All are wrong. What is right here? TB screening should be done at regular intervals. Okay, people with silicosis, okay, we should screen them regularly for TB. They are more prone for tuberculosis. Next, we have this asbestosis. Okay, next we have this asbestosis. Which part of the lungs will be affected in asbestosis? Okay, asbestosis, which part of the lungs will be affected? In asbestosis, okay, lower lobes will be affected, guys. Okay, lower lobes will be affected. Lower lobes. Okay, lower lobes. If you take X-ray, it will show ground glass appearance. Okay, ground glass appearance. Okay, so lower lobes, and if you take X-ray, it will show ground glass appearance. Okay, and they are prone for what disease? Asbestosis. Okay, this year NEET exam the question was there. Okay, asbestosis, they are prone for a malignant mesothelioma. Okay, mesothelioma. Okay, this year NEET question. This year NEET question. Okay, mesothelioma is related with what? Asbestosis. Asbestosis. Lower lobes it will affect, and they will have this ground glass appearance, guys. Ground glass appearance. Fine. Next. So we are in occupational health. Under ESI, Employee State Insurance Scheme, the beneficiaries can get up to 70% of wages, okay, for 3 months under which? Okay, under what benefit? This is the question. 70% of wages. Okay, what is this? So 4 benefits we should know. So the answer is sickness benefit. So sickness benefit, they will be paid if a worker got sick, they will be paid 70% of wages, okay, for 91 days. Okay, if the worker got sick, they will be paid 70% of wages for 91 days. The second one is called as extended sickness benefit. Extended sickness benefit, the worker is really sick. Okay, so suppose for MI or a cancer has come. Okay, in this extended sickness benefit, they can get 80% of wages for 2 years. Okay, stroke, okay, cancer, MI. Okay, there is a list of conditions are there. Third, enhanced sickness benefit. Okay, enhanced sickness benefit. Okay, where will you get this enhanced sickness benefit? So if the person is undergoing vasectomy, okay, vasectomy, okay, facts are important, guys. Okay, we have to discuss the facts actually. The person is undergoing vasectomy, they have to go for 7 days, leave will be given. And tubectomy, 14 days leave will be given. 100% of wages will be given. 100% of wages. Okay, so we have this vasectomy and 7 days, and tubectomy 14 days. So during that time 100% of wages will be given. This we call it as enhanced sickness benefit. Enhanced sickness benefit. Fourth one, okay, maternity benefit. Okay, if the worker, okay, so have to go for delivery, so they will be given leave for 26 weeks. 26 weeks and 100% delivery, 100% wages will be given. Okay, this 100% wages. This we call it as enhanced sickness benefit. Okay, and extended sickness benefit and maternity benefit, guys. Maternity benefit. Okay, fine. So am I clear? Okay, so these are the points we should know regarding occupational health, guys. Occupational health. Fine. What is the answer for this question? This is a topic on environment, and we have this chlorination. Yes. So fine. First, okay, we will come back to this. Okay, first is how will you measure the chlorine demand of the water? Some salient points we will see. Suppose there is a drinking water is there. Okay, how to check how much chlorine is required? So chlorine demand of the water is meant by Horex apparatus. Okay, fine. Then what you are supposed to do is that you have to add chlorine. Usually we add in the form of bleaching powder only we will add. Okay, fine. So the minimum contact period when you are adding bleaching powder, suppose there is a water tank is there in a village. Okay, so you want to add chlorine there. Okay, so how much time after adding chlorine, what is the minimum contact period? The minimum contact period should be 60 minutes, guys. So don't allow the water to come for 60 minutes. That is a minimum contact period. Okay, fine. So after this, when the water is coming out, we require some additional chlorine there. That we call it as residual chlorine. Okay, residual chlorine. So how much residual chlorine is required? How much residual chlorine? So we require 0.5 milligram per liter. Okay, the residual chlorine should be 0.5 milligram per liter. So if on the way some contamination happens, this residual chlorine can take care of itself. Take care of the contamination. That is, then now water is coming to your house, you want to check whether the water is chlorinated or not. For that purpose only we have this test called as orthotoluidine test, to check whether the water is chlorinated or not. Orthotoluidine test. So it identifies, answer is both type of chlorine it will identify, guys. Free chlorine as well as combined chlorine. Okay, so when you have chlorine is there in the water, when you add reagent, it will turn into yellow color. So it will identify both free chlorine as well as combined chlorine, it will identify. This is also a recent question in your exam. FMGE exam. There are 30 people at a camping site. How will they manage their garbage? Okay, so garbage here, what is this is? This is solid waste. What is the answer? You can put it there. What is the answer, guys? Okay, solid waste disposal. We are discussing here about solid waste disposal. Okay, how will you do solid waste disposal? The first one is called as dumping. You can throw, okay, waste. Second one is called as, what we all do is throwing. You identify a place near your house, so every people from every house, they will dump the waste in that particular area. That is dumping. Second is controlled tipping. Okay, second what you can do is controlled tipping. Third what you can do is incineration. Okay, fourth is burial. You can do burial. And fifth is composting. Okay, composting. This composting. These are the various methods. Solid waste is there. Okay, fine. Now out of this, which one can be used for camps? Suppose you go for a trip, you make a tent, you are staying there, you are creating some solid waste has been generated. So how it will be used? Okay, so for burial is the method we can use it for camping. So the answer here is burial, guys. Burial. Controlled tipping, we have some further methods are available. Controlled tipping. So area method, ramp method, and trench method. Okay, area, ramp, and trench method. Okay, few years back the question was asked. Okay, trench method. Okay, if there is a trench, okay, this is repeated in your exam as well as NEET exam also is repeated. So we have a 10,000 population is there. For 1 year we want to dispose the solid waste. How much land is required? 1 acre of land is required, guys. Okay, so 10,000 population. Okay, so 1 year. Okay, so if you want to dispose 1 acre of land, this was asked actually. How much land is required? It's a direct statement from the book, and this was asked. Okay, fine. Next. Nutrition is the last chapter, guys. Okay, so around 8 questions are there. We'll finish it. Answer this question. Come on, answer this. Man was working in a place where they store groundnuts as some poisoning. Most likely it is what? This is what? Apoptoxicosis. Okay, so this is groundnuts. We have this Aspergillus flavus, Aspergillus parasiticus. Okay, they will affect usually the groundnuts. These are storage fungus. Okay, storage fungus. Okay, and they affect. Okay, usually commonly they affect these groundnuts. This is storage fungus. They go and infest the groundnuts. Okay, and people consuming this, okay, they develop symptoms. Okay, hepatotoxic symptoms, GIT, and hepatotoxic symptoms they will develop. Hepatotoxic symptoms. So that's why what you are supposed to do is that you have to reduce the moisture level. This can be prevented by reducing the moisture levels. Okay, we can prevent it by reducing the moisture levels. Okay, so this is storage fungus. Another common question here is, what type of fungus these are? These are called as storage fungus. Okay, storage fungus. We'll see one by one each topic we are discussing here. Next, this is asked in NEET exam also. A patient is presented neurological deficit and history of chronic alcohol intake. Okay, chronic clue here is chronic alcohol intake and neurological deficit. Okay, this is thiamine, guys. Okay, thiamine. Okay, fine. Now, so what we can, thiamine deficiency, it can cause two things. One is beriberi. Second one is Wernicke's encephalopathy. That's what the question is. Wernicke's encephalopathy. So Wernicke's encephalopathy. Okay, so ophthalmoplegia will be there. Okay, so mental confusion will be there. So beriberi means they will affect the nerves also, heart. So dry beriberi, wet beriberi will be there. Okay, so dry and wet beriberi. Okay, so nerves it will affect dry beriberi. Heart it will affect means wet beriberi. So thiamine deficiency. So this is Wernicke's encephalopathy. Okay, this year it is asked in NEET exam also. Fine. Which vitamin increases the iron absorption? These are very simple question. Can you answer it? Which vitamin increases iron absorption? Yes, that is vitamin C, guys. Okay, so vitamin C increases iron absorption. Phytates and oxalates. They decreases iron absorption. Okay, phytates and oxalates, they decreases iron absorption. That's why they say that don't take tea, coffee. Okay, so when you want to okay, along with the food, it reduces the iron absorption. Okay, fine. What is the cutoff value to call a person as anemic based on hemoglobin value? Based on hemoglobin value for males, okay, less than 13 grams per deciliter. Okay, they are called as anemic. Females, to call anemic, females, okay, less than 12 grams. Okay, females, to call them as anemic. Okay, pregnant females less than 11 grams, to call them as anemic. Pregnant females less than 11 grams. Okay, fine. Now what is the name of the program? Okay, that focuses to reduce iron deficiency in India? Yes, we have a program called as Anemia Mukt Bharat. Okay, Anemia Mukt Bharat. Okay, in this program, okay, so we are providing iron. Okay, for pregnant mothers, we are providing iron for pregnant mothers. Okay, from 4th month onwards, 4th month to delivery, they should be taking 60 milligram of elemental iron. They should be taking 60 milligram of elemental iron and 500 microgram of folic acid. Okay, this is prophylactically, guys. This is prophylactically. Okay, that means even if it's not anemic, she has to take. Okay, daily from 4th month till delivery, daily she has to take. Okay, following delivery, she has to again take during lactational period from delivery to 6 months. She has to take same tablet daily. Okay, for pregnant and lactation we are giving from 4th month to delivery and again following delivery to 6 months. So this is Anemia Mukt Bharat, guys. Anemia Mukt Bharat. For children also we are providing, okay, 6 months to 5 years and 5 to 9 years, okay, 10 to 19 years again we are providing. In schools and all we give, okay, 5 to 9 years we are providing, okay, 10 to 19 years we are providing, okay, weekly tablets. Okay, we are providing weekly tablets, weekly iron folic acid tablets we are providing as part of this Anemia Mukt Bharat we are providing, also called as national, okay, so initiative. Okay, so this Anemia Mukt Bharat iron plus national iron plus initiative and Anemia Mukt Bharat we are providing prophylactically. If she is anemic, if a pregnant woman is anemic, so mild anemia means we have to give 2 tablets. Okay, but this is prophylactical. Poor man with gum bleeding is seen in the deficiency. Okay, this is very straightforward question for your exam. What is the answer? What is the answer? Poor man with gum bleeding is the deficiency of what? This represents gum bleeding, delayed wound healing will be there. Okay, delayed wound healing. Okay, this is what? Okay, delayed wound healing will be there. What is this? Yes, this is scurvy, guys. Scurvy. Okay, scurvy. Scurvy is seen in whom? Scurvy. Okay, scurvy is because of vitamin C deficiency. Scurvy is vitamin C deficiency, guys. Vitamin C deficiency. Okay, so delayed wound healing, scurvy will be there, and bleeding gums will be there. Okay, so what is the richest source of vitamin C? Richest source of vitamin C. The richest source of vitamin C is what? It is amla, guys. It is amla, Indian gooseberry. That is the richest source of vitamin C. What is the answer for this question? Multiple times asked question. Diarrhea is there, rash is there. Clue they have given. Okay, rash, diarrhea. Okay, this is dermatitis. This is what it is. This we call it as Kessel's necklace. What is this? Okay, what is this? Kessel's necklace. So this is typical. Okay, this is the feature of niacin deficiency. Niacin deficiency is common in maize eating population. Okay, this is common in maize eating population. It is common, niacin deficiency. So it can lead to this, okay, diarrhea, dementia, and dermatitis. Recently multiple times asked area, these are, okay, diarrhea, dementia, dermatitis, and it can go for death. Maize eating population. Okay, so the interface in the conversion of this tryptophan. Okay, and they will develop all these things. Okay. This is niacin deficiency, diarrhea, dermatitis, dementia, and finally they can go for death. Kessel's necklace, guys. Kessel's necklace. Okay, fine. So what is this vitamin D deficiency causes what? Vitamin D deficiency, it causes children, it causes rickets. In adults, it causes osteomalacia. Okay, children, it causes rickets. In adults, it causes osteomalacia, guys. Osteomalacia. Okay, fine. Next. What is the answer for this question, guys? Answer. Okay, patient came. Okay, patient is having the features of edema. So mustard seed. Okay. So what is the probable diagnosis? What is the probable diagnosis? Okay, fine. This is what? This is epidemic dropsy, guys. Epidemic dropsy happens because of contamination of mustard oil with organamone oil. Okay, not contamination, adulteration. Mustard oil with organamone oil. This organamone oil contains a toxin called as sanguinarine. Okay, it contains a toxin called as sanguinarine. Sanguinarine is a toxin. If they consume it, patient, they will present with, patient will have, okay, so dyspnea will be there. Dyspnea. Okay, so glaucoma will be there. Glaucoma. Pedal edema will be there. Pedal edema will be there. These are the features. Okay, and they can go for cardiac failure. They can go for cardiac failure. They can go. This is, okay, epidemic dropsy. Okay, mustard oil with organamone. Central India cases were reported. And this contamination will be identified by two tests. One is nitric acid test. Second one is paper chromatography test. A paper chromatography test. Okay, these tests will identify them. Okay, this is a clue they have given. Okay, mustard seeds and all they have given. So nitric acid test and paper chromatography test, they will identify it. Okay, fine. So am I clear? So this is epidemic dropsy, guys. This is epidemic dropsy. Dropsy, fine. So what is this endemic ascites? These cases also reported endemic ascites. This happens because of a patient's presence with ascites plus jaundice. Ascites plus jaundice. And this is because of a toxin called as pyrrolizidine alkaloids, guys. This happens because of a toxin called as pyrrolizidine alkaloids. This is endemic ascites. Endemic ascites happens because of pyrrolizidine alkaloids. Okay, so this toxin, okay, can cause ascites and jaundice. Case fatality rate is high. It is around 40%, guys. Case fatality rate is around 40%. Go to the next question. What is this? This is also again a recent question in your exam. What is this? Okay, kesari dal they have given. Okay, kesari dal can lead to what? So this kesari dal contains a toxin. Okay, the question is which are the following not done? We will see. It contains a toxin called as BOAA. What is BOAA means? Beta oxalyl aminoalanine. Okay, it contains a toxin called as beta oxalyl aminoalanine. If the people consume this pulses, actually it's a kesari dal is a pulse. Okay, over a period of time, okay, longer period of time, okay. So they consume this, the diet is more having these pulses over a period of 2 months, okay. They can develop this, what is this condition? They can develop a condition called as letharism, neuroletharism, nerves it will affect. The patient nerves will be affected and they require stick to walking or they may be crippled actually. They may go for crippling. Okay, it goes to various stages, okay. Latent stage, no stick stage, one stick. They require a stick to walk. They require 2 sticks to walk, or they can go for crippling. They can go for, it can be crippled actually. Okay, now, so what can be done? Okay, what can be done? Banning the crop is right. You can ban the crop. You can give vitamin C prophylaxis. You can give. Giving DEC, this is wrong. Removal of toxin can be done by steeping method. We have methods available, steeping method and parboiling. You can remove the toxin. Toxin can be removed by steeping method and parboiling method, guys. Okay. So this is about kesari dal. The condition is called as letharism, neuroletharism. Okay, so answer for this question is DEC. Okay, by giving DEC, that is not going to help actually. Giving DEC, that is not going to help. Last two questions. Fine. What is the answer here? From bajra, and we have this black grains were there. Okay, this we call it as, okay, ergotism. Okay, this we call it as ergotism, guys. This we call it as ergotism. So ergotism, this happens. Why this ergotism happens? Okay, so ergotism happens because of, okay, this bajra plants. Okay, so there is a fungus will go and infest them called as Claviceps purpurea. This is the fungus, Claviceps purpurea. This is a fungus. This is an example for field fungus. Okay, in field itself it will go and infest it. This is a field fungus. So this is bajra. This fungus is called as Claviceps. Previously we saw aflatoxicosis. That is what? Yes, that's a storage fungus. This is a field fungus. Okay, right now. So once it's infested, okay, so patient may develop symptoms. People consuming that, they may develop symptoms. This can be, the question is how these infested grains can be removed. It can be removed by floating in 20% of salt solution. Okay, so this, you put all the grains in the 20% salt. So these infested grains, you can separate it actually. Answer is 20% salt solution. Fine. We'll go to the last one, guys. We'll go to the last question. A 12-month-old child less than 8 kg, malnourished, having vitamin A deficiency. Okay, fine. Now, so in vitamin A deficiency, okay, the first symptom, we will see salient points. First symptom for vitamin A is night blindness, guys. Okay, night blindness. Okay, first sign is what? Conjunctival xerosis, dryness of the conjunctiva. Okay, fine. Now, or you can find, what else you can find is bite or spots you can find. Okay, pearly white lesions on the temporal side you can find, bite or spots you can find. Okay, so night blindness is the earliest symptom. First sign is conjunctival xerosis and bite or spots. If you see any case of this vitamin A deficiency, treatment is 3 days, day 0, day 1 and day 3, day 14 guys. 3 days you have to provide, day 0, 1 and 14 days. On 14 days you have to give the dose. Okay, fine. So what is this? How much it has to be given? How much it has to be given? So look here. So you have to provide less than 6 months, means you have to provide 50,000 international units per dose. Okay, 50,000 international units per dose. 6 to 12 months means 1 lakh international units per dose. More than 1 year, it is 2 lakh international units per dose. Okay, fine. So 3 doses you have to provide, 0, 1 and 14, 3 days you have to give. Okay, 50,000, less than 6 months 50,000 international units, 6 to 12 months means 1 lakh, more than 1 year means 2 lakh. But look at the question actually. The question is, what they are given is, it is less than 1 year, but the child is malnourished child, 8 kg, less than 8 kg. So in such circumstances, it has been given there. Okay, it has to be given there. It has to be less than 1 year. Okay, sorry, more than 1 year, less than 8 kg. 8 kg, you have to provide only 1 lakh international units per dose. Okay, because malnourished child don't give 2 lakh international units. Malnourished child you are supposed to provide 1 lakh international units guys, to avoid the toxicity. Am I clear? This is the catch in that question, and this is the repeated, multiple times repeated question, and you can answer this question. Okay, fine. So this is the last question guys. Okay, so last point here, which is the richest source of vitamin A? Richest source of vitamin A. The richest source. What is the richest source? Richest is what? Halibut liver oil. Okay, halibut liver oil and cod liver oil. Halibut liver oil, that is the richest source. Okay, fine. So hope you guys learn from these videos. Okay, so from this session. Okay, so thanks for listening, and you can put your queries in the group. Okay, you can put it there in the chat, and these PDF you can access it from the app, PW MedED app. So in that FMGE section it is available there. So we will upload it tonight. Okay, so you can collect the PDF this class, yesterday and previous day sessions. All the sessions it is there in the PW MedED app. FMGE, go to FMGE section, in that you can find. Okay, so hope you learn from this. Okay, thanks for listening. See you in the upcoming sessions. Okay, thank you guys. Thank you.